Good morning, everybody. It's Miss Hardy recording for Foundations of Health Science on Tuesday, October 27th. We are going to go ahead and share our screen and get started for the week. This is a Zone B week, so those of you Zone A and virtual learners, let me know if you need anything as you work through all the different assignments this week. And for those of you who are coming in face-to-face, of course, I am here for you. Clicking through the dashboard to Foundations of Health Science, clicking on our daily agenda, and scrolling down. Again, you can access any of your assignments from this page here to find out their name, when they were due, where they are listed in Canvas, okay? So for today, you have a discussion. It is gonna be a quiz grade based on what we did yesterday. However, I'm gonna go ahead and review a lot of what we did yesterday because that was just basic note taking. So you may want to wait to do your discussion board until after we cover this information. And then, of course, it's listed Zoom for notes review. These are for your benefit. Do not miss this chance to learn the material. So here we go. I'm going to back out of this, and I'll cover the discussion post once we get through a good portion of the material. Now, you can, of course, do it without covering the material, but if there's any sort of confusion or anything like that, the Zoom is what can help you understand. So as we covered last week, we are talking about different health careers. And so what this unit is we've put it into different mini units, kind of like what we did with our last unit. Okay, so this mini unit covers a lot of different careers, and so we grouped them together, and you don't want to get behind in these units because the next unit 5.03 that we start, you're going to be learning even more careers. So 5.01 covered our educational requirements, and it covered how you can find those out. I will be posting the key to your assignment that was due on Friday so that if you had any missing points deducted, you'll be able to see where you maybe missed points at. And that key will cover what that career is, and then of course what level of education that career needed. So that will be posted later today, and I'll add that to the agenda after this. So here we go. 5.02 covers dental, diagnostic, emergency, and health information services. So that's 4 career clusters kind of in there. So we're going to start with dental. Okay, so dental careers focuses on the health of the teeth and the mouth. So that's why yesterday I kind of asked you, what do you think about the dentist? For those of you who may be having issues watching the videos, don't worry, you get the information that you need. It's something when we transition the video from the original webpage to uploading it on my Canvas, it seems to be losing some compatibility, but don't worry, they're not necessary for you to learn the material. So we know that the dentist is a doctor, so they have a medical degree, who examines, treats, diagnoses anything with the teeth, mouth, and tissue, so like the gums, the tongue. They can perform surgery, teach you about preventing diseases, and they supervise other dental workers. So they are the boss. Most of them are entrepreneurs, and we covered that in our first unit. 5.01, entrepreneurs work for themselves. So most dentists work for themselves, own part of their business, etc. Dental hygienist is the one who works directly underneath the dentist and has the most training under a dentist. They perform the preliminary exams of teeth. They remove stains and deposits from your teeth, stains and deposits from coffee, smoking, tartar, plaque, lifestyle, whatever. They take and develop your x-rays and then promote preventative care such as brushing and flossing. So again, they work right under that dentist, and they may be able to pick up on an abnormality in your mouth, which means something's not normal, and let the dentist know. Okay, excuse me guys, screen problems. All right. Next is going to be your dental lab techs. They're the ones who repair your dental prosthesis. So anything in your mouth that is man-made. So that is your retainers, your false teeth, your crowns, and things like that go over teeth that have been damaged. That's what your dental laboratory tech does. And that they work under the hygienist as well. Again, we don't all use dental lab techs, but they have the most training under your dental hygienist. Then you have your dental assistant. So dental assistant works under the dentist as well. They prepare patients for exams. They pass instruments. They can take x-rays as well. And they can teach dental care, schedule appointments, handle accounts. Excuse me, guys. And they have the least amount of training compared to the other careers in the dental field. However, again, they're still very much so very vital in a dentist office to make it run smoothly. You may not have as many dental assistants as you do hygienists, because hygienists spend the most time with the patient cleaning their teeth, where assistants can very quickly move from patient to patient. So moving on to diagnostic services, diagnose means to find out what's wrong. So this entire little cluster focuses on finding out what's wrong with patients, help solve problems, and uncover the cause of illness or disease. Okay, moving on, we have a clinical medical lab tech. Clinical medical laboratory technologist, or lab tech shortened, is the person who studies the tissues, fluids, and cells of the human body. So they may be the one that is testing on your blood. They may be the ones who are testing a urinalysis, or if they've ever done like a strep test where they scrub the back of your throat, they're the ones who are testing on that. Okay, so they're the ones kind of on that front line figuring out what's going on with you. So they don't necessarily work one-to-one with patient care. So if you enjoy the medical world, but you don't really like working with people, this may be a great job for you, okay? They perform chemical and microscopic tests, and they also test on human blood, so they work with a lot of equipment. Pretty cool if you ask me. Next, we have phlebotomist. Everybody try to practice phlebotomist with me because that's a hard word to say, okay? So it's like phlegm, botomist, okay? And they're the ones who perform venipuncture. So if we break up this word, venipuncture kind of looks and sounds like vein, and then you have a puncture, which we know is like a hole made in the skin. So venipuncture is the people who stick you with the needle to draw your blood. Doctors' offices may or may not have a phlebotomist just based on their need, because nurses can do this, etc. But phlebotomists really are very well known for working in like blood donation environments. So like American Red Cross, we have phlebotomists that come out here when we have a blood drive, and it's a 10 to 20 hour certification. So this isn't a degree, it's a certification, which means that this person has gone through the necessary training and has had the necessary hours to be considered competent, as we talked about in our first unit, our very first unit, competent or capable to perform this task. Okay, and that's what you see right here. They've punctured the vein and they're drawing blood into this tube. Radiology technologists or radiologic technologists, or rad techs, you may hear, take x-rays, perform ultrasounds, MRIs, and mammograms. Usually radiology technologists or rad techs do one of these things. So you may have a rad tech who focuses on x-rays. You may have a rad tech who focuses on ultrasounds, MRIs, and mammograms. When we're talking in terms of ultrasounds, I know a lot of you immediately go to babies and taking pictures of babies. We actually have a special career for those. That's your sonographer, who takes pictures of babies. So that one is kind of a special one because that's a special field, okay? But you can have ultrasounds all over the body. We can check for blood clots, we can check for masses, we can make sure your liver is where it's supposed to be. So again, ultrasounds aren't just of babies, and I like to clarify that. X-rays, we know that Wilhelm Röntgen taught us how to take x-rays by looking at his wife's hand, okay? And that just allows us to see the bones. MRIs is a super special type of imaging that kind of lets us look at the deepest, darkest parts of our body. And then mammograms test breast tissue for cancer and tumors and things like that, okay? Next, we have epidemiologists. Everybody say epidemiologists, okay? We're gonna put it together, epidemiologists. Epidemiologists are the ones who focus on finding out diseases and how diseases are caused, how they spread, and how we can prevent them. So we talked again before about the CDC, Center for Disease Control and Prevention. And so these people work for the CDC, and they are looking, obviously right now, spending a lot of time looking at the coronavirus. What makes the coronavirus different from other types of coronavirus, different from the flu? How are people catching it, and how can we prevent it? So they're probably really busy right now, and they may not work quite as closely with people. They can work with people, or they can work more in a laboratory setting. But if you enjoy kind of figuring out the mystery behind new diseases and things like that, or outbreaks, this may be a really cool career for you. Next, we have biomedical engineer. Okay, so if you like the way this sounds, then you should definitely pursue my biomedical technology class, because we dive more into what biomedical means. But biomedical engineers are the ones who research different metals used in prosthesis. So the assignment that you had last week when we talked about prosthetics is anyone who has an artificial limb. So if you've ever seen someone who has a metal leg or metal arm or anything like that, plastic, whatever, biomedical engineers research the materials we use to make those, to make sure that it's going to be as similar as we can possibly have it to what your body would normally do. Biomedical engineers also develop artificial organs or artificial valves. They look at, can we make it more like a machine-based hip replacement part? So all of that stuff we can put in your body that is not body parts, okay? Because we know if someone has a hip replacement or a knee replacement, that's going to be metal, plastic, something like that. They also design computer systems, design machines such as patient monitors, blood pressure cuffs, incubators where your babies go when they are really, really young, and then respirators, so what can breathe for you, okay? And then what keeps your air clean. So what I'm going to do, guys, we've kind of gotten about halfway through this slideshow. So I'm going to stop here and give you an opportunity today to answer your question for your discussion board, your quiz grade, and then also give you the opportunity to, I'm going to stop sharing, give you the opportunity to review that key for the assignment that you had on Friday. So what I'm going to do now, give me about 15 minutes, and I'm going to go ahead and post that key for you so that you can review the correct answers if you were to have missed any. And if you have any questions, let me know. Thank you, guys, and I'm here for you all day. If you have any questions, comments, concerns, let me know. Thank you.